Hello, in this video I will be talking about Genotropin, 10 milligram per ml strength growth hormone. It's a recombinant somatropin injection. We call it as a growth hormone, and this is how the pen looks like when you first open it. This, if you can see, it is the medicine is here and liquid is here. You have to first mix both of them. Okay. So we have to hold like this. Here mark A is there, mark A, okay, and I have to rotate till I get mark B. Okay, so it is rotating now. On mark B, if I get, I will get that click sound. Till that I have to keep rotating. Okay. Click sound will come. Click sound, and you can see here mark B. Okay, so mark B. After this, you have to put a needle. Now we can see the medicine and liquid is now dissolved. But some air is there that we have to remove. How to do the removal of the air? You can see the air, air in the medicine. So this is how the needle will look like. You have to open like this and go. Yes, you have to screw it. Once you screw, we remove the needle. Okay. Now again, now we are point B. It have to go to point C. Till then we have to rotate. Keep rotating. Okay. Now the air is gone. Okay. Air is not there. Okay. Point C, and you have not wasted much of the growth hormone. That's about the priming. Then how to give the injections. So for this patient, for example, one patient, if I have to give 1 milligram dosage, 1 milligram is 3 units. Subcutaneously we give it in this thing. So you have to first rotate this one to 1 milligram. See, till 9.1 and 1. So you got 1 milligram dosage. After this small one also have to rotate till the same. So they should be in sync. After that it won't go actually, it get locked. So 1 milligram dosage is now set. Now with this we can inject, go perpendicular to the skin and and press like a button.